If you ever have a cholecystostomy, they may provide you with this sort of setup. How this works is they have a catheter that is placed inside of your gallbladder to relieve pressure buildup inside the gallbladder and to help aid the removal of bile and stones via a tube inserted. This is more or less for people who are non-surgical candidates. You may possibly be a non-surgical candidate or have a family member, and this may be one of the setups. They do sometimes also attach a stitch to the skin outside of the tube inserting opening. That's where you'll see that fine hair. Then you'll see an on-off valve as well as another tube that runs downward to a collection bag. Now, there are two different types that I've seen personally and I've worked with, one being this pump that's attached to the bag that collects the bile and stone, and also there is a gravity drain bag where there's no accordion pump at all involved. So there's multiple different bags that can collect. In order to prevent any sort of blockage in the drain tube, it is important to get familiarized with normal, regular, daily saline flushes via the on-off valve. Now here I'm going to show you a normal way that we would go ahead and drain the collection of bile and stone that has accumulated within this bag. So on this particular bag, it actually has a twist release of fluids found near the bottom. That's the blue section right here. And you would simply unscrew it, so lefty-loosey, to go ahead and open up the valve to release the fluid. And if you want to go ahead and pump the little accordion squeegee up at the top of this type of bag, what that will do is it will pull away any fluid in the line, the tube line that's from the gallbladder to the bag, and it will actually go ahead and work even after it's pushed in. But this way you're removing any sort of fluid built up within that tube, and it will work to go ahead and help to pull the infectious bile away from the gallbladder. Now, after you're done going ahead and dumping whatever has acquired in the collection bag into your dump bag, what you're going to then want to do is close the valve. So it's righty-tighty, close the valve, and then you can wipe away any sludge that's normal left behind with either an alcohol wipe, a paper towel, a napkin, even the glove that you're going ahead and utilizing. And then that's it. It's as simple as draining that bag on a regular basis, depending on how much fluid is being extracted from the individual's gallbladder, and make sure you're properly maintaining the health care of the individual that you are going ahead and working with. Now, in addition to normal draining of the collection that has acquired within the collection bag, it will be also necessary, based upon doctor's orders, to change out bandages, perform daily saline flushes to keep the tube clear. So you may have a full list of different responsibilities. If you're trying to maintain your own health care and this is on your own oneself, it may be a little bit difficult to get used to doing without a helper. So I hope you all enjoyed this visual aspect and look into what life may be like for yourself or your loved one if you have this particular setup. Please remember to like and subscribe for more great videos such as this one. And other than that, if you have any questions or any concerns about anything shown, feel free to drop me a comment. Have a wonderful day.